Now, the World Health Organization said yesterday that there are more than 18,000 cases of monkeypox globally, with the majority of those cases in Europe. There have been a total of 85 cases detected in Ireland since last May. And Dr. Eoghan De Barra, Senior Lecturer at the RCSI and Infectious Disease Consultant at Beaumont Hospital, joins us now on all of this. How worried, first of all, Eoghan, should people be about monkeypox, and remind people perhaps how they might catch it?
Good morning, Ciara. Well, anybody is susceptible to monkeypox, but there are certain risk activities that mean you're at increased risk. And this is something that's been transmitted and going on in West Africa for many years, but now is spilled over into the rest of the world. So most of the transmission so far is from close contact, and much of that from close, intimate or sexual contact. So in most of Western Europe and indeed in the US, most of the cases have been in self-declaring gay, bisexual or men who have sex with men. But not all of them. And usually it's skin lesions, rashes, lumps and bumps. But in severe cases, they can become incredibly painful and disseminate into a rash across the body and occasionally make people very, very unwell.
Okay. So it isn't sexual contact, it's kind of skin-to-skin contact, which may of course involve sex, but doesn't have to. That's kind of what we're saying, isn't it?
Yeah. So the majority, again, of this sort of global outbreak of it is that close, intimate contact, but there are cases of household contact or just close skin contact or close dwelling.
Okay. So in terms of avoiding contracting it, should we advise people that if they have it or if they have the symptoms that they don't engage in any kind of intimate contact with others? What can people do to protect themselves?
Yeah, I think it's all about the information and the education. So at the moment, because the majority of cases are in a group that generally self-identify and generally engage with healthcare and sexual services better, is that among the gay bisexual community that they're aware of it, that if they have skin lesions, to avoid sexual contact or close intimate contact with others, that they get diagnosed. And the other bit is going to be prevention, because there is a vaccine that's effective. It's the old smallpox vaccine. And this government, along with many others, has procured supplies. So I think NIAC announced that yesterday, that there will be vaccination campaign. So we have a small window when the infection is largely in a certain group that, again, access healthcare, we can target it and try to protect that population, and then by protecting them, protect the wider population.
Okay.
Because the other part of this is that there may be spillover into other populations.
No, as is generally the case. But for those who would be eligible for the vaccine, are they men who have sex with men? Is that the cohort that's being targeted with the vaccine?
Yeah, exactly. So men who have sex with men, and particularly those who have a higher number of sexual partners. That's because again, there's going to be a limited supply of vaccine, so you try to target it where it can have the most impact.
Okay, so it's about raising awareness and education, and that vaccine